Frailty is a condition mostly seen in older people. It can increase your risk of going to hospital even if you've only had a minor health problem. It's a bit like a paper boat on the sea. It's fragile, but if the sea is calm, everything's fine. When it gets stormy, the boat is vulnerable. When things get rough, you might need more care. We call this treatment escalation. It's best to plan for this when you are well. We asked people living with frailty and their families and clinicians what went right and what went wrong when they were planning for stormy weather. They said frailty is hard to recognise, feels negative and isn't discussed, so people aren't aware of how vulnerable they could be in a storm. When frailty is discussed sensitively, it can help you get better care and plan for the future. It's hard planning for an uncertain future. People with frailty and their families sometimes prefer to live in the moment because they just don't know what the future holds. Clinicians sometimes aren't confident making plans because they feel the patient's future is too unpredictable. Once the storm comes, making decisions is difficult. Treatment options are confusing. Decisions are made under pressure. People often want their families or clinicians to make decisions for them, but they might have different priorities. So, what helps? Speaking to a trusted clinician, making sure everyone agrees about your condition, your treatment options and your preferences, and starting conversations early. When you're living with frailty, it's important to plan for stormy weather. Make sure you let everybody know what matters to you.